Most seniors taking blood pressure medication assume that if their blood pressure numbers are controlled, if the pill is working, then everything is fine. But blood pressure control and overall health are not the same thing. And the most commonly prescribed blood pressure medication for seniors achieves one while actively undermining the other. Because there is a difference between controlling a number and improving your health. And nowhere is that difference more stark than with the most commonly prescribed diuretic blood pressure medication in senior medicine. The number goes down, the doctor is satisfied, but your potassium goes down, your magnesium goes down, your energy goes down, your muscle strength goes down, your leg cramps get worse, your dizziness increases, and your risk of the very cardiovascular events the medication is supposed to prevent, heart rhythm problems, sudden cardiac events, actually increases as those mineral levels fall. And here is what makes this so serious. Your doctor monitors your blood pressure number at every appointment. They call your treatment a success when that number is controlled. But nobody is monitoring what is happening to your potassium. Nobody is monitoring your magnesium. Nobody is telling you that the medication keeping your blood pressure in the normal range is simultaneously creating a pattern of physical deterioration that looks exactly like aging, but is actually a medication side effect that has a name, a mechanism, and a correction. I am Dr. Michael Kent. I have been practicing internal medicine for over 22 years. Subscribe right now and drop a comment below with your city and your age, and tell me which blood pressure medication you are currently taking and how long you have been on it. I read every single comment. Now let us get into it, because what I am about to share may be the most important conversation about your blood pressure treatment that nobody has ever had with you. Let me start by explaining what thiazide diuretics are, because this is the medication I am talking about today, and why they are so universally prescribed that most seniors have never even questioned whether they are the right choice. Thiazide diuretics, including hydrochlorothiazide and chlorthalidone, are among the most prescribed medications in the entire world. They are recommended as first or second-line treatment for hypertension in virtually every major clinical guideline. They are inexpensive, they are effective at lowering blood pressure numbers, and they have been used for over 60 years, which gives them a veneer of safety and familiarity that makes most doctors comfortable prescribing them without detailed discussion of their consequences. Here is how they work. Thiazide diuretics lower blood pressure by acting on the kidneys, specifically on the distal convoluted tubule, to reduce the reabsorption of sodium. When sodium is not reabsorbed, it draws water with it into the urine. The result is a reduction in blood volume. Less blood volume means less pressure against arterial walls. Blood pressure goes down. This mechanism is effective, but it is also indiscriminate, because the kidney does not selectively excrete only sodium when thiazide diuretics are active. It simultaneously and unavoidably excretes potassium, magnesium, and zinc, the three minerals most critical for cardiovascular function, muscle function, and nerve function in adults over 60. Let me explain exactly what the loss of each mineral does to your body, because this is where the medication that is supposed to protect your heart begins actively harming it. Potassium depletion is the most widely recognized side effect of thiazide diuretics, and yet it is still dramatically underaddressed in clinical practice. Potassium is the primary intracellular cation in every cell in your body, meaning it is the dominant mineral inside cells, maintaining the electrochemical gradient that allows cells to function. In cardiac muscle cells, potassium is critical for maintaining the electrical rhythm of the heart. When potassium drops, a condition called hypokalemia, the cardiac electrical system becomes unstable. Heart rhythm irregularities develop, and the risk of sudden cardiac events, including ventricular arrhythmias, increases significantly. A landmark study published in the Journal of the American Medical Association found that thiazide-induced hypokalemia was associated with a 10-fold increase in the risk of ventricular arrhythmias in adults over 60, the exact population most commonly prescribed these medications. 10-fold. From a side effect of the medication prescribed to protect the cardiovascular system. In skeletal muscle, the muscles of your legs, your arms, your back, potassium depletion causes progressive weakness, fatigue, and muscle cramping. The leg weakness and leg cramping that millions of seniors on thiazide diuretics experience and attribute to aging is in many cases direct hypokalemia from their blood pressure medication. Magnesium depletion is the second and arguably more damaging consequence of thiazide diuretic use, and it is the one that is almost never monitored or addressed in standard clinical practice. Magnesium is required as a cofactor for over 300 enzymatic reactions in the human body. For cardiovascular function, specifically, magnesium acts as a natural calcium channel blocker, regulating the entry of calcium into cardiac and vascular smooth muscle cells. When magnesium levels drop, calcium entry is no longer properly regulated. Vascular smooth muscle contracts more than it should. Paradoxically, blood pressure becomes harder to control as magnesium falls because the very mechanism that allows blood vessels to relax and dilate is impaired. This creates a vicious cycle that is extraordinarily common in seniors on thiazide diuretics. The medication depletes magnesium. Depleted magnesium makes blood pressure harder to control. The doctor sees resistant hypertension, blood pressure that is not responding adequately to the medication. They increase the dose or add a second medication. The higher dose depletes magnesium further. Blood pressure control worsens, and the cycle continues, while the simple correction of magnesium repletion is never considered. A study published in the American Journal of Hypertension found that magnesium supplementation in patients on thiazide diuretics reduced systolic blood pressure by an average of 12 mmHg, more than the additional blood pressure reduction achieved by increasing the thiazide dose, while simultaneously improving potassium retention and reducing cardiac arrhythmia risk. Magnesium depletion from thiazide diuretics also directly impairs insulin sensitivity, increasing the risk of developing type 2 diabetes. A meta-analysis published in Diabetologia found that thiazide diuretic use was associated with a 23% increased risk of new-onset diabetes, a risk that was significantly attenuated when magnesium supplementation was provided alongside the medication. Zinc depletion is the third mineral consequence, less discussed but increasingly recognized as significant. Zinc is required for immune function, wound healing, testosterone production, cognitive function, and taste perception. Thiazide-induced zinc depletion contributes to the immune vulnerability, cognitive decline, and loss of taste and appetite that many seniors on these medications experience, effects that are almost never attributed to the medication itself. Now let me address the dizziness and falls risk, because this is where thiazide diuretic use becomes a genuinely life-threatening problem for seniors over 60. Thiazide diuretics cause orthostatic hypotension, a sudden drop in blood pressure upon standing, in a significant percentage of seniors. When you are lying down or sitting, your blood pressure is maintained at a certain level by your cardiovascular system. When you stand up, blood pools momentarily in your lower limbs before your cardiovascular system compensates by increasing heart rate and constricting peripheral vessels. In healthy adults, this compensation happens in seconds. But in seniors with thiazide-depleted potassium and magnesium, whose cardiovascular compensatory mechanism is impaired, this compensation is slow and incomplete. Blood pressure drops dramatically upon standing. The brain receives less blood for several seconds. Dizziness occurs, and falls happen. A study published in the British Medical Journal found that thiazide diuretic use was associated with a 72% increased risk of serious falls and fall-related injuries in adults over 65, with the highest risk occurring in the first 30 days after starting or increasing the medication dose. 72% increased falls risk from a medication prescribed to protect cardiovascular health. Now let me tell you about John. John was 72 years old when he first came to see me. He was a retired firefighter, a man who had spent his career in one of the most physically demanding professions possible, and who had been deeply proud of his physical capability throughout his life. When he came to see me, he was visibly diminished. He had been on hydrochlorothiazide 25 milligrams daily for 3 years for hypertension. His blood pressure was controlled, consistently around 128/78. His doctor considered his treatment a complete success. But John did not feel like a success. His legs cramped every single night, severely enough to wake him up 2 to 3 times. His energy had dropped so dramatically that he struggled to complete tasks that had been effortless before his medication. He had developed significant muscle weakness in both legs, confirmed by functional testing. He had experienced 2 episodes of severe dizziness upon standing in the previous 6 months, one of which had resulted in a fall that bruised his hip badly enough to require imaging. When I tested his mineral levels, the results were not surprising to me, but they were shocking to him. His serum potassium was 3.2 milliequivalents per liter, below the lower limit of normal of 3.5. His serum magnesium was 0.65 millimoles per liter, significantly below optimal, and his zinc level was in the lowest quartile of the reference range. Every single symptom he had been experiencing for 3 years, the leg cramping, the weakness, the fatigue, the dizziness, the falls risk, was a direct and predictable consequence of the mineral depletion caused by his blood pressure medication. None of it was aging, all of it was iatrogenic, meaning caused by medical treatment. I worked with his prescribing cardiologist, with John's full consent and active participation, to implement a comprehensive correction plan. We reduced his hydrochlorothiazide dose from 25 milligrams to 12.5 milligrams and added a potassium-sparing diuretic, spironolactone, at a low dose that maintains blood pressure control while actively conserving potassium and magnesium. We added magnesium glycinate 400 milligrams daily. We added a potassium-rich dietary protocol, emphasizing avocado, sweet potato, white beans, and wild-caught salmon daily. At his 6-week follow-up, John's blood pressure remained well controlled, 126/76, on the adjusted medication regimen. His potassium had risen to 4.1. His magnesium had risen to 0.88, solidly optimal. His leg cramping had reduced from nightly to twice in the previous 6 weeks. His energy, by his own description, had returned to a level he had not experienced in 2 years, and he had not had a single episode of orthostatic dizziness since the medication adjustment. He told me, "Dr. Kent, for 3 years I thought I was getting old. I thought my body was failing. My doctor told me my blood pressure was perfectly controlled and I should be grateful. Nobody told me the medication was doing this. Nobody tested my potassium or magnesium once in 3 years. I want every senior on thiazide diuretics to hear John's story, not to frighten them, not to make them stop their medication, but to empower them to have a conversation with their doctor that most of them have never been offered the information to have. Here is exactly what I want you to do after watching this video. At your next doctor appointment, or call and request an appointment specifically for this, ask your doctor to order a comprehensive metabolic panel that includes serum potassium, serum magnesium, and serum zinc. If you are on any thiazide diuretic, these should be monitored regularly, ideally every 6 months. If they have never been tested in the time you have been on this medication, that is a conversation worth having. Ask your doctor specifically about potassium-sparing alternatives or combination approaches, such as the addition of a low-dose potassium-sparing diuretic alongside your current medication, or whether a different class of blood pressure medication might achieve equivalent control with less mineral depletion for your specific situation. Ask about magnesium glycinate supplementation, 300 to 400 milligrams daily, alongside your current medication. Multiple studies have shown that magnesium supplementation improves blood pressure control in patients already on thiazide diuretics, meaning it may actually enhance the effectiveness of your medication while protecting the minerals the medication depletes. Increase your dietary potassium intake through whole foods, avocado, sweet potato, white beans, spinach, salmon, and bananas, which provide potassium in a form that is readily absorbed and does not interact with medication the way potassium supplements can at higher doses. And be aware of the orthostatic hypotension risk. Rise slowly from bed and from chairs. Sit on the edge of your bed for 60 seconds before standing. Hold on to something stable for the first few seconds after standing. These simple habits dramatically reduce the falls risk associated with thiazide-induced blood pressure fluctuation. I want to be absolutely clear about something before I close. I am not telling you to stop your blood pressure medication. High blood pressure is a serious condition, and untreated hypertension causes stroke, heart attack, and kidney failure. The goal is not to eliminate treatment. It is to optimize treatment, to ensure that the medication controlling your blood pressure number is not simultaneously destroying your mineral balance, your muscle function, your energy, and your quality of life. That optimization starts with a conversation with your doctor. And today, I have given you everything you need to have that conversation. Drop a comment below right now with your city and your age and tell me which blood pressure medication you are on and how long you have been taking it. I want to know, and I read every single comment on this channel. Tomorrow, I am revealing the 3 natural compounds that have been shown in clinical research to lower blood pressure as effectively as low-dose thiazide diuretics, without depleting a single mineral, without causing orthostatic dizziness, and without increasing falls risk. Subscribe right now and turn on notifications, because that video goes live tomorrow morning and it could be the most important blood pressure information you have ever received. I am Dr. Michael Kent. Share this video right now with every senior you know who is on blood pressure medication and has never had their mineral levels tested. It costs nothing to share, and it could protect someone from 3 years of unnecessary deterioration like John experienced. Like this video, subscribe to this channel, and I will see you tomorrow. This video is for educational and informational purposes only and does not constitute medical advice, diagnosis, or treatment. Always consult your qualified healthcare provider before making any changes to your medication or supplement routine. Never stop or reduce prescribed blood pressure medication without first speaking to your doctor. High blood pressure is a serious medical condition requiring proper medical supervision. Individual health circumstances vary, and results may not be typical for all individuals. Dr. Michael Kent is a fictional educational persona created for informational purposes. Patient stories including John are illustrative examples based on common clinical presentations and are not representations of specific real individuals. Research studies referenced are based on peer-reviewed, published scientific literature. Always verify health information with your own qualified medical professional before making any health decisions.